World Hospital Hebbal, we are celebrating Prematurity Day. Dr. Vikas Satvik, he is a senior consultant in Neonatology and Paediatrician. He's going to talk about a few questions arised in parents about prematurity today. Why do we observe this day as prematurity, doctor?
Okay, so this day is observed as World Prematurity Day. This started way back in 2008 when parents and organizations in Europe they started uh, among themselves to raise awareness among the community, to the government, to the population, to the hospitals, everybody basically about what exactly is a premature baby, what are the problems associated with the premature baby, and how to handle them. So it is basically meant. It was started as a campaign to raise awareness, and then soon the WHO and UNICEF took over this concept, and they introduced a World Prematurity Day, where now we observe this day worldwide to basically enhance, encourage the spread of information about preterm babies, so that people, government, organizations, hospitals, everybody are more aware about what exactly is a preterm baby and what are the things we need to do for them to prevent them and to support them.
What is preterm baby?
Okay, so according to the WHO, a preterm baby is any baby that has been born earlier than 37 weeks completed gestation. So we know that most of the usual period is about 39 to 40 weeks. So what happens is these babies come early, earlier than they are scheduled to come. So they arrive anywhere before 37 weeks, and then they get the term as a preterm baby. Basically, they are again subclassified. So any baby that comes between 24 weeks of age to 37 weeks of before completion of 37 weeks is actually a preterm baby. So there's a huge area for a preterm baby to come across. Now, in that, basically, if you see 33 or 34 weeks to 37 weeks are kind of easy to manage, have less complications. 30 28 to 32 weeks are the ones which are kind of extreme preterms, and even less than that, 27 weekers are kind of very preterm babies, and these are the ones which have a lot of complications. So from 24 to 27 weeks are the ones which are having a lot of complications. So again, they're subclassified. So anywhere from 24 weeks of gestation to up to 37 completed weeks of gestation are basically preterm babies.
How severe is this problem?
If you look worldwide, the problem is actually quite large. So we have almost every year about 15 million babies born preterm, and of which 1 million babies die every year from the problems associated with prematurity. If you look into that again, then there are also babies which survive, but then end up with long-term problems. So these are the babies that are born preterm, survive, and then they go on to have problems which they carry on all along in their lifetime. So this causes a lot of burden on the parents, on the child, and on in the community, to the country. So it's a big problem in itself, and that's why the premature babies are to be taken seriously, and then the problems associated with them has to be addressed.
Why, doctor, babies are born premature?
There are various reasons. Till date, we most of the babies born preterm, we don't know the exact reasons, but we do know there are some reasons. For example, if you look at multiple gestations, which means there are many babies, so the mother may be carrying triplets or a quadruplet, so they usually come out early. Then there are the most commonest causes nowadays are, especially with the advancing maternal age, we have mothers who actually who have their pregnancies later, so like 35 or 40. So that's advancing maternal age is another factor for preterm babies. uh, they can also have problems in terms of diabetes, hypertension. Because of these reasons, the babies have to be delivered early because it will continue to affect the health of the mother. So they are delivered early. There can be infections. There can be other abnormalities with the genital tract. For the example, the uterus, where the babies are not held for long, and babies come out early. So the various factors associated with it, and it's important for us to recognize what factors are there and to be able to prevent these factors coming into the picture in the first place, so that preterm babies actually are not delivered, so they actually then carry forward to term gestations and delivered. So better access to healthcare, early access to healthcare, routine follow-ups with the gynecologist or obstetrician uh, are some of the things that usually will help prevent these babies come out early.
What is the current situation?
In India, it's actually a lot worse than in the rest of the world. So if you look at India contributes about, so when I said about 15 million babies, so in worldwide, India contributes about 3.5 million babies, preterm babies every year. Now, of which we have about, like India stands among the top 10 countries which contributes to preterm babies. So we are producing a lot of preterm babies, when in fact we should not be. Various factors are involved in this. If you look at it, 24, this equates to about 24% of all the entire preterm babies come from India. So this is quite a huge burden. It's not only a burden for the child, it's not only a burden for the family, it's also a burden for the country, because in terms of economic burden, in terms of socio-economic burden, uh, in terms of the health care costs, the health burden that actually these babies, these families, and the country faces is enormous. So I think we need to take premature babies more seriously than what we are. Try to provide more care, and then get along with reducing the number of preterm babies in India.
Then what is the solution for this?
So the solution is basically to provide care which is accessible, which is cost effective, and care which is given at the right time. So if you look at it, the solution is not only by having a neonatal side of it which provides for the preterm babies, but it's also trying to prevent these preterm babies. So this is the role where the obstetricians have, where they basically, like I said, early access to healthcare, routine monitoring, prevention of maternal complications, good nutrition in the mother, appropriate spacing between pregnancies, and having pregnancies or getting pregnant slightly earlier than basically preventing late pregnancies. So the ones which we know are the causes, there we need to prevent them. So if you look at that, then that will be the preventive aspects. And once the babies are born, then having the right care, basically in a good, appropriate setting, will definitely help or go a long way in providing for these preterm babies so that they survive. The first thing. The second thing is they survive without complications, and they go home and they do well. In fact, I had one of the places where I worked previously in England, uh, in the hospital, actually that was opened by a athlete who was participating in the Olympic Games. If you look at her, she was born 26 weeks preterm, and she came back as an athlete to open that unit. It was a renovated unit, so she came back to renovate the unit, open the renovated unit. So this is what we want. We want them to lead as a normal life as possible, and not have any complications that are associated with preterm babies.
What is the theme for current World Prematurity Day?
So the current theme for the world, current 2019 Premature Day is basically the right care at the right time, and the right place. So which basically is what I'm trying to say is, we need to give them the right care. So right care not only for the babies, but also for the mothers, so that they have appropriate follow-ups, appropriate treatments. All the preventive strategies are in place. Once the babies are born, they need to be born in the right place. Because if you take an example of, let's say, 26-week baby, and if that is born in a peripheral setup, then they will face difficulties, because the infrastructure may not be there, the right training facilities may not be there, or the right investigative modalities may not be there. So it becomes very difficult to manage this baby then. So automatically this baby will have issues. If this baby is to be born in a, say, a level 3 unit, or a place that has appropriate equipment, staffing in place, then I think this baby can do well, and carry on to go on to lead a normal life. So that's the important part of it. So basically the right care at the right time and the right place is what the current theme is. This is basically to make sure that in NNF Karnataka, for example, has been actively involved in providing this kind of a support to a lot of peripheral places, so that the staffs are adequately trained, appropriate equipment is in place, and the right referral pathways are in place, so that if they suspect an extreme preterm, then that actually automatically can be referred on to a next center, next higher center, and the government so far has done a lot of efforts and has been doing good work in terms of interacting with the private sector, especially the doctors in the National Neonatal Forum of Karnataka, to establish this. And I'm very happy to say that there are some excellent outcomes being recorded. Going forward, I think if this carries on, then I think we can do a lot.
How is motherhood is equipped to cater this current theme?
So, if you look at motherhood, we have one of the best doctors working here, one of the brightest minds working in motherhood hospitals. We have a network of hospitals, in especially if you look at Bangalore, it has many centers spread around Bangalore. Yeah, the quality of care that we provide and the equipment standards, the staff training, or be it the so it basically ticks all the boxes at the right place, the right time and the right care. So the preventive strategies are in place. We follow one of the best protocols that are available, the evidence-based protocols in applying, preventing preterm pregnancies, going on to give to births. And if you look at the neonatal setup, it's one of the most well-equipped setup that you can find currently in Bangalore. It's got everything if in case a baby ends up in trouble, to provide a 24/7 service. So you have all the super specialty services if in case it needs. For example, if you have let's say preterm babies have sometimes issues with the heart, so we have a cardiologist in place who actually will look into the scan of the heart, give further management if required. If you look at gut issues, they usually have some problems with feeding. Sometimes they can have what's called a necrotizing enterocolitis, in which case we require surgery. So our surgeons are available 24/7. We can provide care. So, but most importantly, among all of them is trying to prevent these problems. So we actually make sure that none of the babies end up with any of these problems, and give them the right care in an incubator in a temperature that is required, with access to staffing 24/7, ensuring that they grow well. So we're basically trying to provide the same type of care what actually a mother would have provided in the womb. It'll be the same care, so there's no different, but it's the babies outside. So the nutrition is taken care of, developmental growth is important for this baby. Not only the physical growth, but the developmental growth is important. So there is a concept called developmental care that is also incorporated in our care. So motherhood, if you look at overall the motherhood hospitals, it's well equipped to actually provide the right care at the right time and the right place.
I heard about a program called Prepare. Can you give me some details about it?
This we started a few years back in motherhood, and I think we are one of the first in the country to actually bring out this program. Prepare is basically parents of preterm babies. So what exactly happens is the parents who have been in the neonatal intensive care have gone through that months of stress, or months of seeing their baby being treated. When they get discharged, we request them to come back and basically sit with those parents who are currently in NICU, so that they can talk on a one-on-one basis. Sometimes there are things that parents don't discuss with us, though we do discuss with the parents regularly. Trying to find their issues, the problems, and helping them understand, support them, go through the journey, the neonatal intensive care. We sometimes we found it better if there are parents who have been through this journey, come back into the neonatal unit and talk to the existing parents, help them, support them, guide them. It gives them a lot of benefits, a lot of understanding happens, and it actually helps them understand how the journey is happening currently with their babies. We found it to be very, very effective and have
Moral support.
yes, yes. So it's so these sessions are usually mentored by one of the consultants, sitting in along with the preterm ex-preterm baby parents, so the preterm babies are already gone. So these parents sit there, talk to the current parents, and we help them, we kind of support them, and it has had an excellent feedback. So parents really appreciate, they feel well supported with this program.
Doctor, any message to parents or community?
The one message I would have to the community or the parents or would be parents is basically make sure that you take appropriate care, get the necessary health checkups that needs to be done in a good setup. And if it ever happens, and God forbid it does not happen, but if it does happen that you do want to have a preterm baby, overall, if we have preventive health strategies in place, then I think we would see less number of preterm babies, and I hope that India goes on to have less number of babies. Thank you very much.